Well, nobody wants a sick child for the holiday season. Nobody. But unfortunately, the CDC says respiratory illnesses among children in the U.S. are up right now, especially for kids under 5 years old. And respiratory virus activity is especially high in the southern and western U.S. The good news, experts say what we're seeing across the country is manageable and we should not worry, as we're better prepared than ever to fight these nasty viruses.
The pathogens or the viruses and bacteria that are involved in these infections are ones that we see every year. And so we might be seeing higher than usual rates, or we might see some areas that have small outbreaks of these, but this is standard and this is quite expected, and this is all very manageable.
So in terms of fighting back now, for the first time ever, vaccines are available for all three of the major fall and winter respiratory viruses. We're talking flu, COVID-19, and just approved this year, vaccines for RSV. So let's ask the expert. Joining me now is Dr. Natasha Bhuyan from One Medical. What are you seeing in your practice?
Yeah, so right now we are seeing an uptick in respiratory viruses. So people are coming in with cough, cold, shortness of breath, fevers. They don't know what they have. They're coming in for testing. And we're really seeing colds and COVID the most.
Oh, okay. Okay, so what can kids and adults do then?
Yeah, so the number one thing is to wash your hands. That is what actually prevents a lot of the spread of infection. The other important thing, this is so key, is stay at home from school or work, especially for kids. Daycares and schools are the places that they're getting sick. For adults, it's work. So if you're feeling sick, stay at home, take that PTO. Other key thing is if you are sick and you're coughing and sneezing, do it into a Kleenex or into your arm. Don't cough or sneeze out into the kind of the ether. And then if you're sick, take care of yourself. You know, get rest, get recovery, and feel better.
Okay, so this is what I'm wondering. I know COVID has kind of been in the rearview mirror for the bulk of it, but there are still people masking up. So I'm wondering, when should people be masking?
Look, masks do work in preventing the spread of respiratory viruses. So masking right now is a good idea. But where exactly do we mask? I tell people mask in crowded areas. So that might be places like airports, and then also mask in places with poor ventilation. Now, some people ask, should I mask at work?
Right.
Well, some workplaces have HEPA filtration. They open the windows. So if they have good circulation, you don't necessarily need to mask, but really it comes down to, are you in a crowded place like a store, and how is the ventilation? And right now it is a good idea because there are all these respiratory illnesses circulating.
Yeah. So definitely, as people are traveling right now, busy travel season at the airport and on the planes.
Yes, absolutely. That is where I wear a mask. And then other places, I also wear a mask at the store. I don't see a lot of people wearing masks right now. But with this increase in COVID cases, it might be a good idea to grab that mask again.
And real quick, I have seen people mask up and they've told me, oh, I'm not feeling very good.
Oh, yeah. I tell people, if people are not feeling good, it's a good idea to stay home. And other key here, it's really hard to tell the difference between cold, flu, COVID, strep, RSV. And so if you have symptoms, see your doctor and get tested. The reason why is the treatment for all of those are different. There's a different medication for the flu versus COVID. So see a doctor, get tested, figure out what you have and if you need treatment.
And then you know where to go. Exactly. All right. Great advice, Dr. Natasha. Thank you so much. I know we're going to see you in a couple